Good evening, everyone. Welcome. Thank you for joining the April Neighborhood Health Series event. Today is April 15th, Tax Day. I hope everyone is well and is staying healthy. The topic for tonight is a really interesting one. About 16 months ago, we polled all of our guests, our regular guests, and asked them what topics they'd like us to report on. And sexual health through the years came up multiple times. And so we're very happy to be able to respond to that need and deliver this here today. We hope you'll join us next month with Dr. Geraldine Crane. She'll be talking about lessons learned from her mother, who was a Holocaust survivor, on May 20th. After that, we'll be going into our summer break, and we'll be back in September with our fall lineup. Thank you very much to our sponsor, Clark County Credit Union. I wanted to thank Craig Fraley, who's here right now. They are a very loyal sponsor, and without them, we would not be able to conduct this series. Their donation helps to fund this, as well as goes into our student scholarship fund. So we're very, very grateful for everything they do. They're an incredible community partner. Just by way of a couple of housekeeping items, please feel free to use the chat or Q&A function that you have for any questions, and we'll try to hold most questions to the end, but if there's any burning questions, please let us know, and I will help answer those with Dr. Madison. And if possible, to please mute your microphone, and also be aware that some of you do have your camera on, which is fine. Just want to make sure you're aware of your own, of your background. With that, I'd like to move into presenting our very special presenter today. Dr. Christina Madison is the founder and CEO of the Public Health Pharmacist, a PLLC company, public health consulting firm. She is a clinical pharmacist specializing in public health with a focus on infectious communicable diseases. As a past president of the Nevada Public Health Association, she's been asked to share her clinical public health and infectious disease expertise with local, state, and international media outlets and NGOs. Most likely, you've probably seen her on TV most recently. Dr. Madison has an intimate knowledge of the impact public health messaging, policy, and legislation can have on communities. A trusted and valued healthcare professional with 14 years of experience in public health and 17 years experience as a pharmacy professional, an advocate for victims of human trafficking, vulnerable population, and the underserved, Dr. Madison is also a graduate of the 2021 Las Vegas FBI Citizens Academy. She's received multiple awards and recognitions, including being named 2020 Educator Healthcare Hero by Nevada Business Magazine, recognizing unsung heroes in healthcare working on the front lines, Pharmacy Times, and Parata Systems 2020 Next Generation Pharmacist honoree in the Civic Leader category, named one of the top 25 healthcare influencers by Las Vegas Entrepreneurs Magazine in June 2020, and Pharmacy Times Pharmacy Hero in May 2020 for her patient education and pharmacy advocacy during COVID-19. She's also been recognized for her patient counseling skills and public health vaccine advocacy. Dr. Madison is an associate professor of pharmacy practice with Roseman University of Health Sciences, College of Pharmacy. She's currently the director of Roseman University COVID-19 vaccine operations, logistics, and distribution, as well as the point of contact for the state of Nevada for COVID vaccines. She has personally facilitated the administration of over 5,000 doses of COVID vaccine 19 in her community since January 2021. She maintains 2 active clinical practices with Huntridge Family Clinic, which focuses on the LGBTQ community and is one of the largest providers of HIV prevention and gender-affirming care services in the state of Nevada, as well as Volunteers in Medicine of Southern Nevada, where she offers immunization and communicable disease care. Advocating for public health and the profession of pharmacy to improve the health and wellness of vulnerable populations and the underserved is her passion and mission. Please join me in welcoming Dr. Christina Madison.
Thank you, everyone. That was a lovely introduction. Sometimes I forget how long my bio has gotten, so I think I need to maybe cut a few of those things out. So with that being said, this is actually one of my favorite topics, just talking about sexual health and sexual wellness. So we'll go ahead and get started. I'm going to go ahead and share my screen. Okay, can everyone see me okay? Looks like my screen may have froze. Oh, I think we're good now. Okay, and I'll go ahead and hit the slideshow here. All right, so as we mentioned before, thank you again, everyone, for attending this evening. We do appreciate your time and attention, and also wanted to give a moment for our sponsor today, Clark County Credit Union, to say a few words, and also wanted to thank them again for their continued sponsorship, because it is without peril, and we have been having you as our sponsor now for, I don't know, goodness, close to 5 years now. It's been a long time. So that is admirable, and we really appreciate your continued support and your support of the community here in Southern Nevada.
Thank you. I'm Craig. I'm the Director of Business Development with Clark County Credit Union. I've been with them for 26 years. And as the medical field credit union, we are very proud to help sponsor Roseman's Neighborhood Health Series. It's a valuable talk they do every month, and we find a lot of value in this, and we're very proud to sponsor it. If you should ever find yourself needing financial wellness, you can reach us at ccculv.org. We do everything a bank does, but we're owned by our members, and we are not for profit. So at the end of the year, we give our profits back to our members. Since the year 2000, our 47,000 members have shared in over $68 million back in their accounts. So that's a pretty good group to be in. Again, you can find us at ccculv.org. Have a wonderful evening. Enjoy this presentation. And Dr. Madison, the floor is yours.
Thank you so much again. So let's go ahead and get started. And as I mentioned before, this is one of my favorite topics for a few reasons. One, because I think it's often something that is not discussed and should be, because ultimately, I think your sexual health is related to your overall health and wellness, and we'll get into some details about that in just a couple minutes. But I wanted to start out with what is sexual health. So if you look at the WHO, or the World Health Organization's definition, they define sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. So that could mean a couple of different things to a couple of different people, but ultimately, we want to make sure that individuals are enjoying sex safely, as well as enjoying their sexual experience. And that is something that can happen from our teenage years all the way through our twilight years. And hopefully by the end of this, you guys will see that everyone should be having sex, and should be having it and enjoying it. So we'll talk about why that is. So when we think about sexual health, we really want to understand that the fact that your sexual health typically involves a partner. So whether that partner is a same-sex partner or opposite-sex partner is going to be determined based on your sexual orientation, and possibly with your gender identity. And I'm going to go into a little bit of detail on that a little bit further on in the presentation. Also noticed when I was looking at our audience list that we had somebody that also listed next to their name their pronouns. So thank you for that. My pronouns are she, her, and hers. And so I think that's something that is definitely becoming more common, and I hope part of a culturally competent assessment of all of our patients. So that positivity around sexual health, as well as that mutual respect for our partner. So that includes sexuality, our sexual relationships, as well as the possibility of having a pleasurable as well as a safe sexual experience, free of any coercion, discrimination, or violence. So as you heard mentioned in my bio, I just recently graduated from the FBI Citizens Academy here in Las Vegas, and we have a very active field office around things such as human trafficking. And so one thing that I learned during my training, there were many things, was that unfortunately, Las Vegas is a hub for a lot of illegal sexual activity and coercion and human trafficking at both the national level as well as the international level. And so we do see people being brought here from other countries as well as across state lines, and that is a federal crime. So we want people to feel comfortable with their sexual experience. They want it to be mutually beneficial to both parties and free of, like we said, coercion, discrimination, or violence. And so sexual violence is something, unfortunately, that disproportionately impacts women, but I don't want to discount the fact that it also impacts men as well. And I see that in particular with the patient population that I deal with on a more regular basis, which is my LGBTQ community. So we do see that happening in our trans youth, as well as my men who have sex with men population. So sexual health is part of your overall health and wellness. And it matters if you're having a lot of it, as well as if you're not having any at all, because there's usually a reason why that's happening. If you're engaging in, multiple sex partners, or if you only have one sex partner, but unfortunately you're not having sex with that partner, those are all things that your primary care provider should be talking about with you, assessing, and hopefully helping to correct. So sexual health and prevention of sexually transmitted infections is also part of public health, which is why it's something that I'm advocating for. So when we think about public health, we really think about the health of the many versus the health of the one. So as that relates to sexual health, one of my other areas of expertise is in infectious communicable diseases, which includes sexually transmitted infections. So if I treat one person's sexually transmitted infection, I don't treat just them, I treat the whole community, right? Because I stop them from being able to transmit it to someone else if they're not engaging in safe sex practices. So public health deals with the health and wellness of the population as a whole, and that's distinguished from clinic medicine with its emphasis on preventing communicable diseases rather than curing them. So we want to prevent you from becoming infected with a sexually transmitted infection and spreading it to others, or treat you in order to prevent you from spreading it to more people, right? And then focusing on the population and the community rather than the individual. And it's not to say that I don't want to have that patient-centered care, but that my impact with that one patient doesn't just happen with that one patient, but has a community benefit. So I wanted to just take a couple minutes to discuss sexual orientation and gender identity, because I think these two concepts are very important when we think about sexual health. So one of the things that I know that sometimes people struggle with is talking about their sexual orientation or their gender identity. And if you don't feel like you can have that open and honest conversation with your healthcare professional, you may be at risk for something, and we as your healthcare professional may not know because you don't feel comfortable disclosing your sexual orientation or your gender identity. And so all people have a sexual orientation and a gender identity. And I will tell you, some individuals, this may be fluid. I particularly see that with my younger population where, some days they may identify more in the masculine space, and some days they may identify more in the feminine space. And then there's some times where they don't identify as either, right? So this concept of gender fluidity, as well as fluidity of sexual orientation, where we're not as concerned necessarily with our sexual partner's gender, but more so the person themselves. So at some point, you may be attracted to a person and their personality that happens to be of a male gender, and other times you may be attracted to somebody that may be of a female gender, which may be the same sex as you. And so those concepts are separate, and I think oftentimes they get kind of melded together. But someone's sexual orientation is separate from their gender identity. So how people identify can change, and the terminologies vary. And so if you're not familiar with these terms, hopefully I'll give you a little bit of a taste, but ultimately that's a whole other presentation in itself. So our gender identity and sexual orientation are separate concepts. So just for example, I consider myself to be a cisgender female that is heterosexual. So that means that my gender assigned at birth, which is female, is the same as the gender I identify, and I have an opposite sex partner who is male. So cisgender, which is my gender assigned at birth, and then that's my gender identity, and then my sexual orientation is heterosexual because my partner or my spouse in this instance happens to be a cisgender male. So that's how that works. And again, those are two separate concepts. So just because you are transgender or a person of trans experience, you may or may not have relationships with same-sex partners, meaning the same sex that you identify, or opposite sex partners, or the opposite gender than what you identify. So looking at this is kind of a three-dimensional picture, wanting to let you guys know that these things can overlap. When we think about sexual orientation and how a person characterizes themselves in relation to their physical and emotional attraction to others. So if we think about identity, right? So that's the first thing. So do I consider myself to be lesbian, bisexual, straight, queer, or something else, right? And then who do I love? So who am I attracted to? So what gender or genders am I attracted to? And then what's my behavior? So even if I'm attracted to someone, I may still not engage in relationships with those individuals, right? Or the opposite of that may be that I may have a behavior, but maybe not necessarily attracted to that person or consider myself to be gay or bisexual. So when we think about behaviors, that means who am I actually engaging in sexual activity with? So am I engaging in an activity with somebody who is the same gender as myself or the opposite gender of myself? And that's what encompasses your sexual orientation. Here's another way of thinking about this. So if you guys haven't seen this graphic before, it does a really good job of kind of explaining the fluidity around gender identity and sexual orientation. So this is my genderbread person. It's a take on the gingerbread man. So as you can see here, the outward expression. So how do I present to the world? So am I presenting to the world as female, or am I presenting to the world as male? Or am I presenting to the world as non-binary, so neither female or male? My identity is going to be, how do I think of myself, right? So that's really a construct of the mind. And then who do I love, right? What's in my heart? Who am I attracted to? And that's really my sexual orientation. And then lastly, my sex. So is that my sex assigned at birth, or is that the gender that I identify as? So all of these things can be on a spectrum, right? And so as you can see here, you can see they've got the blue down here as sort of your degree of womanness or your degree of manness. Your gender expression would be either your femininity or masculinity, and then your anatomical sex would be either your femaleness or your maleness. And again, all of these things are not simultaneously, or how should I rephrase that? They're simultaneous, but not mutually exclusive, right? So we've got our identity, which can be separate from our expression, which can be separate from our sex, which can be separate from our gender, which can be separate from our orientation. Or they can all align, right? And we can be more in kind with what I think society thinks is more of a typical, individual, right? So that concept of having a cisgender heterosexual person. But ultimately, I would say there are much more people now that are more in that fluidity space versus prior to, say, maybe 15 to 20 years ago. And again, I think having that open and honest conversation with your healthcare provider really helps them to be able to make appropriate discussions with you, as well as appropriate decisions about how to manage your care. And that's why I'm advocating for all primary care providers to take a sexual history at all primary care visits, because if we don't know if you're having it, how can we know if you're doing it safely? All right, so addressing sexual health in primary care. So I know that there are some providers that don't like to talk about this concept because they think that it's engaging in a conversation that may be uncomfortable for the patient, or that they feel like they're going to somehow embarrass the patient. But really what I want you guys to take away from this is that your sexual health is part of your overall health and wellness, and it should be part of your general wellness visit, right? So it should be part of that thought process that if I'm thinking about your heart health or your diabetes or your eye health or your mental health, your sexual health should be right up there at the top, right? And then your sexual health assessment should be conducted at every primary care visit. Obviously, if you're going back to your provider more regularly than your just annual health visit or health wellness check, you may need more assessment. And that, again, depends on going back to that concept of behavior. Or it may be something that just gets addressed at that annual visit. But understanding an individual's sexual health needs will improve to provide optimal patient care, which includes making sure that you are doing a culturally competent interview with the individual and taking into consideration their sexual identity as well as their sexual orientation, which starts with things like knowing what the person's pronouns are, knowing what their preferred name is, if they are somebody who is a person of trans experience, or if they don't identify with either gender. So I think that's kind of the first and foremost. A lot of the patient population that I deal with, the reason why they come to my clinic is because they feel like the traditional healthcare system has failed them. Or if they did ask about sexual health or wanting to get a sexual health assessment, that they felt judged or they felt stigmatized. And that's really what we want to take away from this, right? No one should feel like they are doing something that is inappropriate. No one should feel judged. I'm not trying to get into your bedroom. I just want to make sure that if you are engaging with, some encounters, that those encounters are done safely and that you feel that you are not coerced, that there's no violence involved, and that you feel safe and protected. Okay, so let's talk a little bit about taking a sexual history. So one of the things that I talk about with my student pharmacists, because this comes up, obviously they haven't felt comfortable necessarily with taking that sexual history before being on my rotational experience. I really like to tell them that they actually need to be comfortable with themselves first, right? So if you don't feel comfortable with yourself, you don't feel comfortable talking about sex as it relates to your own personal health and wellness, how are you going to be able to talk about it with your patients? Right? Unfortunately, they smell blood in the water, right? They can see if you're uncomfortable. So you got to make sure that, that patients feel comfortable. And I think even just from the perspective of being the patient, right? When I go to my healthcare professional, I think that it shouldn't be just something that occurs with my OBGYN. It should be something that's being asked about my overall health and wellness, right? And so I want to be a good patient as well and make sure that I'm honest and open with my provider during that assessment as well. So the first thing I would say is that, we want to set the stage. We want to bring up sexual history as part of the overall history. One of the number one things I talk with my patients about is that these are not questions that I'm targeting you for. I ask all of my patients the same questions, and that this really is something that is going to be a confidential conversation. And ultimately, if you are being coerced or feel like you being threatened with violence, we need to get you help and we need to get you assistance. Because ultimately, we know that people who have either been victims of human trafficking or sex trafficking, the one and only time that they may not be with their trafficker may be at a health or wellness visit. And so again, we want to make sure that we're providing that safe space. So there's going to be several screening questions that will be asked. So the first one is, have you been sexually active in the last year? Do you have sex with men? Do you have sex with women? Or do you have sex with both? We've even further modified this question to even say, do you have sex with people who identify as a man, or do you have sex with people who identify as being a woman? So this also helps us to determine if someone is engaging in relationships with individuals of trans experience, which again, does have a slightly different risk associated with it when we talk about things like sexually transmitted infections. And then also, how many partners have you had in the past year? And then obviously we can tailor this depending on how frequently the person is coming back, or if they were having challenges with their sexual health. And we can do this every year. You can do it every 90 days. It's whatever is appropriate for you and for your relationship with your provider, as well as with your patient. So when we look at sort of the categories, right? So I'm going to ask you different questions based on the responses to these questions. So if you tell me that you've been celibate and you've had no partners in the last year, I would like to ask why, right? Like, what's going on? What can we help you with? Is this by choice? Is something going on? Do you not feel healthy? There's enough of a reason to ask the question why you aren't having sexual encounters, if it's been a year, as well as if you're having multiple sex partners, right? So either extreme is not good. We want you to be engaging in this for your overall health and wellness. So we want to ask about past partners. So is the reason why you're not engaging with those partners because you're no longer with that partner anymore? Are you recently divorced? Have you separated from your partner? Are you just choosing to spend time focusing on yourself, right? So all of those things, do you have any concerns about your sexual health? If you're in a long-term monogamous relationship with a mutually monogamous patient, or excuse me, a mutually monogamous partner, and really the key there is mutually monogamous. So you can be monogamous, but if your partner's not monogamous, then you may have some challenges there, right? And so we want to talk about pregnancy plans if you are still a woman of childbearing potential. We also want to talk about things like trauma or violence. If you're having any challenges with sexual function, or if you are having sexual satisfaction, and then any other concerns that you may have around your sexual health. And then if you're engaging with multiple partners, then obviously we want to talk a little bit more about your risk for things like sexually transmitted infections. So who are your partners? Are you engaging in substance use? Have you had any histories of sexually transmitted infections in the past? Have you experienced things like trauma or violence? Are you using something for pregnancy prevention? Again, sexual function as well as sexual satisfaction, and then any other concerns you may have around your sexual health. And then last but not least, any follow-up assessment that may be needed. So at the time of the appointment, if you are assessed for things like sexually transmitted infections or sexual function or satisfaction, then there may need to be a follow-up visit. So I think about our risk assessment using the 5 Ps. So that's partners, practices, past history of STIs or sexually transmitted infections, if you're using protection for sexually transmitted infection, and then pregnancy plans. So those are the 5 Ps for the assessment. So really that just helps me as the healthcare provider to be able to determine what your risk is and how we can help you moving forward with enjoying sex safely. So that's the first thing I actually ask my patients is, instead of interrogating them and asking them questions about their sexual health, I usually say, how do you enjoy sex? Right? That's a much nicer way of asking the question about your sexual health than just petering off a bunch of questions about how many partners do you have? What type of sex do you have? Right? Like, we want people to feel comfortable with that conversation. And when we're asking you how you enjoy something, that's a much more favorable conversation to have. Okay, so implicit bias. So this is something that I wanted to bring up. Unfortunately, we still are seeing some patients being treated differently than others in our healthcare system. And so I would highly recommend that if you have a provider that you're seeing, finding out if they have gone through implicit bias training, as well as maybe that potentially influencing any decisions that they make around your sexual health. As you can see here, there are a lot of different things that may attribute to those biases that may include your age, your race, your sex, your religion. There are all kinds of things that unfortunately come into play when we are providing healthcare. And so this is something that I've personally gone through. I have all of my students go through. And I think the number one thing that I've heard is that oftentimes there are biases that we don't even know are there, which is why sometimes there are these unconscious biases that once we are aware of them, we can do a better job of providing culturally competent care to our patients. So, did you know that it's STD Awareness Month as well as STD Awareness Week? So this week is STD Awareness Week. So this week is designated every year, every April, as being the time for us to talk about things related to sexual health. So this year's campaigns, there's several of them. So it's every April. And then again, it's typically that second week of April that's designated as the Awareness Week, but the whole month of April is STD awareness. And unfortunately, if you guys were not aware, we are in the midst of an STD crisis. So sexually transmitted infections was actually deemed a public health crisis by the National Institutes of Health, as well as the World Health Organization. So in quarantine, people were not staying by themselves. They were getting together with other people. And unfortunately, when they were getting together with other people, they may or may not have used protection and may or may not have decided to test themselves during that time. Also, because we've had access issues with our healthcare system because of the pandemic, those regular channels that people would typically engage in if they needed to be tested for STDs, unfortunately, were not there. And then obviously, because we've had an overwhelming, attention on the pandemic, some of these other preventative care things have kind of gone by the wayside. So STD Awareness Week provides an opportunity to raise awareness about STDs and how often they impact our lives. This is billions of dollars that impact our healthcare system in, treatment, loss of productivity, unfortunately lost pregnancies, infertility risk. There are many things that happen because someone has had an STD. And so we also want to talk about relieving stigma and fear and discrimination. And so because I deal with patients that are either at risk for HIV or currently infected with HIV, this is something that comes up often, especially surrounding new sexual encounters after their HIV status is known. But really the biggest thing here is once we know your status, then we can figure out how we can move forward safely. So it also ensures people have the tools and the knowledge to prevent, test for, as well as treat STDs. So a large majority of our sexually transmitted infections, our communicable illnesses, have treatments, and not just treatments, but they have cures. So that's a big thing that I want people to know, is that a lot of these things are silent infections that you may not even know you have, but they have a cure and we can get you treated. And really, it's potentially the best first date you could ever have, right? Everybody gets tested, everybody knows about their sexual health, and then you can just move forward with your relationship. So this year's themes and campaigns. So the first one, and I thought this was really fitting because we were talking about sexual health through the years, is that, again, I want to emphasize that people should be enjoying sex at any age, right? From adolescence, young adulthood, all the way through our twilight years or our wonder years, right? So everybody has an opportunity to enjoy sex throughout their whole lifespan. So with our adolescent population, we are targeting them with a campaign called Get Yourself Tested. So this encourages young people to get tested, especially if they are newly sexually active. And then also this concept of talk, test, and treat. So this is a new campaign that the CDC came out with just this year. And this is really encouraging individuals and healthcare providers to take action to incorporate sexual health services, in particular into primary care. And that's because we know that if we ask the question, right, especially as a healthcare professional, if we're asking the question, patients may be more likely to talk about their sexual health, engage around their sexual health, and be more likely to get tested as well as treated. And so again, it's on us as the healthcare professional to ask the questions and to make our patients feel comfortable so that we can have an open and honest dialogue about their health. And then syphilis. So syphilis strikes back. So unfortunately, this is actually one of our STDs that is one of the easiest to treat. It's penicillin based. And unfortunately, we are seeing a rise in the number of cases in our gay and bisexual men, as well as pregnant women and newborns. So we are, unfortunately, here in Nevada, we are #1 in the country for primary and secondary syphilis rates, as well as #2 in the country for congenital syphilis rates. So we know that we have a problem, and part of this is, individuals not being able to access prenatal care, as well as maybe not knowing the risk for genital ulcer diseases such as syphilis. Also, because typically it's a painless ulcer, so a lot of people don't even realize that they have it, and then continue to have sexual encounters, not realizing that they're continuing to spread the infection. So, so these are our 3 awareness campaigns and our themes for this year. But again, I think it really highlights the fact that we're trying to make sure that everyone, from adolescence all the way through, our twilight years, understands that we are wanting to prevent you from having these infections, and we want you to be enjoying sex, but enjoying sex safely. Okay, so I hope this video works. I think we'll try this out. Might have to go back out and reshare. Hold on one second. One moment. I'm just making sure that the audio works. Okay, here we go.
I just sit right here.
Let me show you something. Party, party, yeah. Let's get this party started. Party, party, yeah. Let's get your body rocking. Party, party, yeah. Let's get your body moving. Party, party, yeah. Let's get it on. Party, party, yeah, yeah. Party, party, yeah, yeah.
Okay, so as you can see here, this is the Florida Department of Health, and they really wanted to bring awareness around the fact that seniors were still having sex, but unfortunately they were seeing a rise in STD cases because of the fact that the seniors were not thinking that they needed to use a condom, right? Because at that point, they weren't worried about pregnancy prevention. And when they met their partner may have passed away. And at that time, their partner may have not had another partner when they were with them, right? When they were married. And so it was just really an opportunity for them to kind of poke a little bit of fun and a little bit of lightheartedness. But really the key here is that we want everyone who is having sex to be able to enjoy sex safely. And that includes our senior population. Oh, looks like it ended up taking me all the way back to the beginning. One moment, please. Okay, hopefully you guys are still with me. Great. Yes. So safe sex for seniors. So we definitely want our senior population to feel like they're being engaged in this conversation as well. Okay, so providing access to services. So the key here is that I think that, again, going back to that concept of having that open conversation, that open dialogue with your patient, and making them feel like they are comfortable having that discussion around sexual health. So providing access to these services is something that I've been advocating for at the primary care level, in addition to not just your pediatrician's office or the OBGYN's office, right? So who should be providing sexual health assessments? So as you saw earlier, we should be asking those questions about the 5 Ps. We should be asking those 3 questions that we talked about earlier. So really, who should be offering these kinds of assessments? And the answer to that question is really everyone. But in general, we want to think of that concept that everyone who is able to consent and not be coerced should include your pediatrician's office, right? Because our adolescents and young adults are engaging in sexual activity. That includes our primary care offices, as well as our geriatricians, right? So having that conversation about having sex and having enjoyable sex as we get older, because things change as we get into our twilight years. And then patients should feel comfortable asking questions around sexual health. So this starts with that culturally competent care and ensuring a safe space around sexual orientation as well as gender identity. So one of the things that I've seen with the patient population that I've had is that, maybe somebody just never asked the question, right? And so, someone who only, confided in a family member or a friend about their true feelings, or waited until they were in their late 60s to talk about the fact that they engaged in same-sex relationships. They always hid it. They always felt like they couldn't disclose that because of fear of judgment or fear of discrimination. And so again, I think these conversations are becoming more common, and especially within our social diaspora. So I think that these are things that we should be asking about at the primary care visit as well. So I wanted to go over this concept of trauma-informed care and understanding that there are some patients that may be coming from a place of trauma when they come to the doctor's office. And so one of the reasons why some people may not want to talk about their sexual health or their sexual experience is because they experience trauma associated with their sexual health. And so this concept of trauma-informed care really is centered around mental health and specific principles. And so that includes the concept of screening for trauma and trauma recognition. So not everyone is going to answer yes to this question, but those who do, it's something that may help you to be able to provide better care. Understanding that trauma directly affects your health, and then having that patient-centered communication and care. So having the patient be the one that drives the conversation, and that we are listening, as well as affirming that that person may have experienced trauma in the past and that trauma may be impacting their current health status. Also emphasizing emotional safety. So letting them know that they are in a safe space and that there's a confidential conversation, and then avoiding things that may trigger the memory of the trauma. And then knowledge of helpful treatments for patients that have had issues with traumatic experiences. So I really loved this graphic and wanted to include it. And it does a really lovely job of really talking about the concept of trauma-informed primary care. And so trauma and toxic stress involve feelings of being overwhelmed, and can make life experiences very difficult, and can lead to emotional and physical stress, and then potentially may result in substance use disorders. And so we know that during this pandemic, a lot of people experiencing stress and trauma. And so we want to meet the patient where they are and understand that when we're talking to them about things that are associated with their health. So, we know people have gained weight. We know people have, you know, had new partners or lost old partners. All of these things kind of combine, but there's hope. There's hope beyond the hurt, right? So we want people to feel like they are able to engage in healthy relationships, and that includes having a healthy sex life. So some of the principles around this concept of trauma-informed care are safety, number one, trustworthiness and transparency, peer support and mutual help, and then collaboration and mutuality. So again, going back to that concept of patient-centered care, where the patient is the one who's driving the conversation, feeling of empowerment, that you have a voice, that you feel affirmed and you have a choice, and then really identifying and addressing some of those issues around cultural and historic, gender-based or racially based issues. So another thing is expanding access to care, right? And so some of the things that we've experienced during this pandemic is challenges with access to care, and in particular, reproductive health services. And so one of the ways that we've tried to expand assistance with reproductive health services is through pharmacists being involved in the direct provision of contraceptive services. So as you can see by this map, there are several states that allow pharmacists to be able to provide contraceptive services to patients without a prescription. And so again, this just goes back to that concept around reproductive health, reproductive justice, letting women know that they can have agency over their bodies, which may include their decision of whether or not to have a child. And so again, whatever your beliefs are, making sure that women have a choice, and that includes their sexual health, right? So if they're enjoying sex, that could result in a child or conception if they're not using protection or if they're not using contraception. And so having the ability for people to have access to these services will allow women in particular to be able to make those decisions for themselves. So hormone therapy. So our hormone therapies, so this is more for my individuals that are aging, right? So we know that our individuals that are either undergoing menopause, which is defined as cessation of menses for at least 1 year. So typically that's anywhere from 50 to 60. We know that individuals can continue to menstruate up until their 50s. But again, it's that complete cessation or not having your menstrual period for up to at least a year, before you can be defined as being in menopause. And so when we go through menopause, it causes changes to our genitalia. In particular, oftentimes it results in vaginal dryness, which can really make sexual activity uncomfortable for women. And so understanding that, knowing that those hormonal changes can impact not only your ability to have sex, but to have pleasure from sex, as well as your libido, so your willingness and your wantingness to have sex. And so there's a couple of different things that we can do in order to help to make the sexual experience more pleasurable. So one is to provide hormone therapy. So for women in particular, this may include things like estrogen or progesterone, or some creams for the vaginal dryness, or using types of lubricants during your sexual encounter. Also using things like testosterone. So testosterone, I know this concept may be new to some of you, but testosterone is actually very helpful for women in menopause to help with things like mood, energy, and libido. And so we have this small pellet. it basically goes, it inserts right under the skin, and it slowly releases a small amount of testosterone into the bloodstream over time. And those small testosterone pellets have been hugely impactful for some of my female patients. They report having more energy, feeling like they were in their 20s again, wanting to, for lack of a better way to say this, jump all over their spouse, because they felt that they actually had the drive, right? The drive to want to engage in sexual encounters again. And then again, that the testosterone can also help with some of the vaginal dryness as well. So, not to forget about the men, but our men can also suffer from something called andropause. So, as we age, our hormones can become depleted. And then, just like women go through menopause, men can go through a testosterone deficient period. And that can, again, cause issues with energy, fatigue, libido, even your mental health, right? So, a lot of people say that they have this mental fog associated with this period of time. And so adding hormone therapy through things like testosterone treatments, there are things called bioidentical hormones. There's a lot of pharmacies that actually compound creams and tinctures and injections that can be used to help with things like virility and sexual dysfunction, things around erectile dysfunction, right? So not just, the act of having sex, but are you able to complete that sex act, right? Are you having challenges with sexual dysfunction? In addition to, are you wanting or desiring to have sex? And so these are all things that we want our patient population that are in their twilight years to know that there are solutions for. And so when you have these conversations with your healthcare provider, don't feel embarrassed. Please bring it up to us because, again, your sexual health is related to your overall health and wellness. So just to reiterate again, these hormone deficiencies are a normal part of aging and are something that can directly impact your satisfaction and your function around sexual health, and is something that is easily correctable. All righty, so just some clinical pearls, and then we'll open the floor for some questions. So again, your sexual health is part of your overall health and wellness. A sexual health assessment should be incorporated into all primary care visits. Education and training around trauma-informed care and implicit bias can help provide optimal patient care. And then sexually transmitted infections are on the rise and are preventable. So sex can be enjoyed at every age and can be enjoyed safely. So thank you so much for your time. Oh, it looks like we got moved some things around. Uh-oh. Well, I can talk a little bit about harm reduction strategies. My apologies. We'll talk about this and then we'll take some questions. So related to sexual health as it relates to sexually transmitted infections. And so if you are somebody who's at risk for sexually transmitted infections, we want to make sure that you have access to things to help prevent those infections, which includes things like condoms. And so if it was up to me, I think condoms should be available at every pharmacy, right? And so not just at your public health department or your Planned Parenthood or your STD clinic, but every pharmacy. And I think that's because a lot of times, especially if you see them at the pharmacy, they're kind of behind a gate, which is behind like some plexiglass. And it really gives this perception that the condoms need more protection than the people, right? And that's not good, right? So if you already have that kind of feeling when you go in to get these, either external or internal condoms, it makes you not want to purchase them. And if you're not going to purchase them, then you definitely aren't going to be able to use them, right? You can't use a condom if you don't have one. And so accessing things like low cost or no cost barrier methods, either through means from the sexual health clinic, the public health department. We have a harm reduction agency here called Track B, which does clean needles as well as condoms, as well as pregnancy tests. So again, these are all these different agencies that you may be able to access these barrier methods. Also, Medicaid will cover the cost of condoms. So if you have a prescription, you can actually get Medicaid to cover the cost of condoms. I just learned about that. Needle exchange. So if you have somebody who's suffering from substance use disorders, and then doing that sexual health assessment, that includes 3-site testing. So not just your reproductive area, but oral pharyngeal as well as rectal, and then access to medication-assisted treatment or opioid replacement therapy. Also mental health counseling. So we definitely want to improve access to mental health counseling for individuals, especially if they've experienced sexual violence or things like intimate partner violence. And then access to stable housing. So, you know, we have people who may be engaging in transactional sex because they don't have stable housing or don't have access to food. So we want to provide those resources so that they are less likely to engage in risky sexual behavior. And then things like PEP and PrEP, which is HIV prevention. And I think we are done. So sorry about that. Got a little bit out of order, but thank you so much for your time and attention. And again, sexual health is part of your overall health and wellness. And I really want people to feel comfortable about having a conversation with their healthcare provider about their sexual health, because part of the reason why we have a rise in STDs is because nobody wants to talk about it. So we definitely need to talk about how you enjoy sex and how you enjoy sex safely.
Thank you, Dr. Madison. If I can open up the floor with a question, and maybe it'll encourage some other questions, if that's all right. There seems to be an increase in the number of these sort of shopping center hormone clinics, new mail, et cetera. So in terms of someone that may, for instance, a man that may be, low on with his testosterone, what would be the best pathway? Would it be through his primary care and through an endocrinologist? Or are some of these sort of shopping center stores like new mail, are they legitimate? What are your thoughts on that?
So excellent question. And I think the first thing I would say is that unless your testosterone is actually low, there is almost no benefit to giving you more, right? And so some of these places I think are talking about the use of testosterone without maybe doing that assessment. And so I would encourage you to go to your primary care provider and actually see if you do have a deficiency, and then kind of go from there, because there may be some other things going on. So I agree, endocrinologist, primary care doctor, both of those could be a good place to start. Now, I am not as familiar with some of these, what you called a shopping center boutique agencies. But again, if they do choose to go to one of those, I would just ask for what the science is behind, their proprietary blend, or, ask what's in, the testosterone formula that they're providing. Are they providing you with injections? Are they providing you with pills? Because here's the thing, testosterone is not absorbed orally. So if they offer you pills, those pills are not going anywhere. They can't get into your bloodstream. So it's either through a tincture or through transdermal means or through injection, especially for testosterone. So they could have something that you can rub on, or have like a cream or a tincture that you can put that goes through the skin, but it's not going to be absorbed if you take it in a pill form, at least for testosterone. For estrogen therapy and for progesterone, those can be taken orally as well as in a cream or an injection. So I think the first thing is just understanding your lab values and knowing, are you truly deficient? And then, looking at some other potential causes that may be part of your either your sexual dysfunction or your decreased libido. So sometimes it may be things like uncontrolled heart disease or uncontrolled diabetes that may be the reason why you're experiencing things like erectile dysfunction, and it may have nothing to do with your testosterone. So getting that full assessment that also includes your sexual health assessment with your primary care provider, I think is really the way to go.
Thank you.
I see someone that I know on the call. Hi, Richard. How are you? Sorry to call you out. Richard has a long-standing history in the public health space and does amazing advocacy. He's worked for the American Lung Association. He was with St. Rose. I think you're still with St. Rose. Are you still with St. Rose?
Yes.
Oh, how are you?
Oh, good. Thank you. Thank you for the presentation. That was really wonderful.
Oh, I'm so glad to hear it.
Yeah. I really suggest, especially our senior peer counselors to be on the call. I hope somewhere out there,
Yeah.
because this could be really important for them.
Yeah. And like I said, I mean, I think so there's two things, right? So one, if you think that your patients that are older are having sex, you're definitely not thinking about them having STDs, right? Because their one thought process is that it's fine, I can't get her pregnant, right? So, but that's, that's only one component of it. And again, really thinking about it from the span of where are you at in your twilight years, right? Where are you at within life? And so every stage of life brings a slightly different challenge, especially as it relates to sexual health. So not just related to things like sexually transmitted infections, but your satisfaction around your sexual encounters, right? Because we don't want you to not enjoy it, because that's the whole point, right? Because it goes to your overall health and wellness.
Also, working in the HIV community, now that there is these wonderful new treatments, people can expect to live a normal lifespan.
Yes.
And it also includes remaining sexually active into their senior years. So again, this is very important information and a valuable presentation for that. Thank you very much.
Yes, and also the concept of U equals U, right? So for some of you who may not be as much within that HIV space or sexual health space, the concept of U equals U means undetectable equals untransmittable. So that means if you are somebody who is infected with HIV and you are able to maintain what we call an undetectable viral load, meaning your virus is so low that it can't be detected on a blood test, you cannot give it to your partner sexually. Like zero chance. Like 70,000 sex acts. We studied it. It was the partners trial. None of those encounters resulted in someone's partner becoming HIV positive. So I think that's another part of that destigmatization around sexual health and having conversations about sexual health is if someone happens to be HIV positive, that is no longer a death sentence. And that doesn't mean that they can't have sexual encounters, right? And they can have them safely.
What I'm wondering too, in this presentation makes me think about is people who are in assisted living or some sort of long-term care facility. It's just assumed that they'll have no sexuality or sexual feelings. And then of course, in those situations, it's almost like a prison where any type of sexual activity is considered
Taboo.
Or taboo, yeah.
No.
So that brings up a lot of questions in my mind.
Oh yeah, no, Florida in particular has had a huge issue with this, right? Around assisted living and senior facilities. That's why they're seeing a rise in their STD rates around their senior population. And so that's why they had that advocacy campaign around, we all do it. Let's just do it safely, right? Whichever way you do it, we just want you to do it safely, right? And that was because we saw these instances in particular where these older men would lose their partners, or the women would lose their partner, and then there would be like maybe 4 or 5 women to like 1 or 2 men, and disproportionate, right? Because we know oftentimes the male partner will pass before the woman. And so these communities where they missed their partner, they again can't get her pregnant, it should be fine, right? And then there's not that many men to go around, and so they kind of have friends. So without a better way to say that, one gentleman is getting quite a bit of action. And so you can see that it can spread, the STDs can spread so quickly because, they're engaging with multiple partners.
Yeah. A lot of issues come up in this topic.
Well, I don't call it an issue. Again, nothing is unfixable. And if I had my way, I would go out to all the senior homes and I would have a bucket of condoms and talk to them about utilizing personal lubricants. But that's just me.
Yeah, no, that's good. That's a great attitude.
No, I mean, again, I think it's just being comfortable, right? Like, and being comfortable with yourself. Oftentimes I'll have students ask these questions and they just get red in the face. And I'm like, what's happening? And they're like, I'm just so embarrassed. I can't ask these questions. Like, this person could be my grandparent. And I'm like, you got to take all that away. There's no judgment. This is a judgment-free zone. And again, it's that starting off that conversation with, how do you enjoy sex? Who are your partners? What parts do you play with? Right? Like it's having a dialogue that's non-judgmental and really, again, going back to the fact that everyone has it, right? Like everyone has it. We just need to talk about having it safely.
Yeah.
And if you're not having it, let's talk about it.
We have a question, Dr. Madison.
Oh, yes, I see that.
Okay. Would you like me to read it to the audience?
Sure, go for it.
Okay. Please give a primer on the availability and use of female condoms. Also the use of female condoms on those who do not use them for STD or pregnancy protection, such as protection for vaginal thinning due to female cancer treatment and aging, for example.
So first and foremost, thank you so much for bringing this up. And typically, just to let you know, I did talk about it just a touch, and it was under the harm reduction strategy. So we typically now will refer to it as an internal condom versus an external condom. And that is because saying a female condom limits it to only being used in people who identify as female. Or have female genitalia. And so the reason why I bring that up is because I do have some of my MSM, or my men who have sex with men population, that will use it as an internal condom when they're engaging in rectal sex. With that being said, I agree with you that so the condom itself it is commercially available depending on what store you go to. I've seen it in a handful of retail pharmacies. I know that the health department at one time was providing it's now the FC2, or the female condom 2. It's the second version of it, that they were providing those condoms to people. And then I have not heard of it being used for the vaginal, the lining, the thinning, but I think that's a fantastic idea. And I definitely think that, that is a utilization that would be helpful for women who have had issues with those types of vaginal cancers. And again, it is flexible. It is made out of a non-latex material. It has an internal and an external ring, so it can go over the labia, as well as that it does have a fair amount of lubricant that comes with the product. And so it's just the one-time use, and then you can obviously utilize another one for additional encounters. But yeah, it's something that I think is definitely underutilized in our population, and has a lot of utility. Great question.
Any other questions before we wrap up?
Thank you, Mary, for attending tonight. I saw one of our Board of Trustees members there as well.
Yes. And thank you, Dr. Madison, for tackling this subject and making it very comfortable for everyone. Um,
I wanted to have my co-presenter, Dr. Hunt, unfortunately was not able to come, but I think it would have been a lively banter if we had Dr. Hunt on here as well.
Yes, and everyone, this recording of this session will be posted tomorrow on speakers.roseman.edu. You can find all the prior presentations as well as upcoming presentations. Dr. Madison, big round of applause. No one else can hear the clapping. They're clapping. You can't hear their clapping.
Yay, thank you, Richard. Oh, thank you, Ingrid. Oh, thank
There
you,
we go.
Kathy. Thank you
Yeah.
guys. Thank you everyone who stayed. I hope this was educational and a little bit fun. Because again, talking about sex should not be a chore. You're very welcome.
Take care, everyone, and have a wonderful evening. Good night.
Good night.